with the healthcare, what we're seeing now, or what I'm hearing from all of our developers, every retail center, we're overbuilt on retail. A lot of places there's too much retail, and so the retailers themselves, they used to need 20,000 square feet for their store. Now they can get by with 10,000 feet because they're selling so much on the internet and selling out of their space. But now there's a bunch of kind of, I'll call it bad space within a retail center that a typical store does not want to go. But on the flip side, if it was a medical use, a doctor office or some radiology or something that, there's not that many of those people around, and if you have to have an appointment, you don't care if it's in the front of the mall or the back of the mall, you're just going to go to wherever it is.
Right.
So that's what I'm seeing, or what I'm hearing, and that's kind of a new trend that I'm seeing that's impacting, it's helping retail because it's allowing those developers to lease space that they normally would not be able to lease to a retailer. Then on the medical side, it's a whole lot easier to park at a shopping center than to go to, a hospital and pay to park and then, follow the red line to the green line to the blue line to find the doctor's office. That's just my experience.
No, you're dead on, and I think it's a couple of things though. The retailization of healthcare. It's number one. It's driven by you guys behind the camera and the millennials and the X's and whatever the next ones are. It's I want it fast, I want it convenient, and I want it cheap. That's one driver. The second driver is the Affordable Care Act, or Obamacare. It's to drive patient care out of the hospital, so inpatient to outpatient, so that more and more regular services you would have in the hospital being driven to outpatient. I mean, it's not only just primary care and diagnostics and maybe an urgent care. You may go for your total hip replacement. You may go for your knee replacement and go home that afternoon. More and more outpatient delivery is becoming more common. But guess what? There's already people there in that space. They're called retail spaces. Yeah. So they are actually competing for those sites because you want to be where? On the going home side, on the right,
Yeah.
So they're competing with, just name a retailer, name a Walgreens, and they've actually got services within themselves that we're seeing a lot of. So the whole outpatient strategy of a healthcare system is a new phenomenon. They've got to decide where to put it, what to put in it, hire the doctors, make sure they're providing the services in the areas where they want to be, where the demographics support those services.